What if I told you an AI model could diagnose illnesses better than human doctors? Scary, right? Well, OpenAI just unleashed something groundbreaking. Its latest model, So-1 Preview, might be the closest thing we have to a robot doctor. But here's the kicker. It's outperforming human physicians and even GPT-4 in complex medical cases. So, should doctors start updating their resumes? Let's dive in. Today, we're exploring a jaw-dropping development in AI. OpenAI's So-1 Preview, a medical diagnostic system that's redefining how we approach healthcare. Researchers recently put it to the ultimate test, pitting it against GPT-4 and seasoned doctors. The results? Stunning. By the end of this video, you'll understand how So-1 Preview is reshaping medicine, whether this tech could really replace doctors, and why it might save lives or terrify you. Trust me, this is a future you need to know about. Researchers put So-1 Preview, GPT-4, and human doctors through their paces, using complex cases from the prestigious New England Journal of Medicine. And we're not talking about simple colds or flu here. These were cannot-miss cases, the kind that make even the most experienced doctors sweat. Here's where it gets wild. In 3 particularly challenging cases, So-1 Preview nailed rare and complex conditions that GPT-4 completely missed. It scored 60 to 75% accuracy in diagnoses, miles ahead of older AI systems, and even creeping close to the performance of human clinicians. But it wasn't just about identifying diseases. Researchers also tested how well these systems could recommend treatments and diagnostic tests. And here's where So-1 Preview flexed its muscles. It scored an 85–90% accuracy in reasoning about medical management. Compare that to GPT-4's 40–50% and human doctors' 30–40% when relying on traditional resources. Think about that for a second. This AI isn't just listing symptoms. It's designing sophisticated, step-by-step plans for medical tests, plans that mirror expert doctors' approaches. For example, in a case involving a rare autoimmune disease, So-1 Preview didn't just guess the condition. It outlined which blood tests, imaging studies, and specialist referrals were needed, almost like it had a stethoscope of its own. Here's what really sets So-1 Preview apart. It's consistent. Even in the trickiest diagnostic challenges, it matched or slightly outperformed human doctors. That's because AI systems don't get tired, overwhelmed, or influenced by biases, unlike humans. But don't cancel your next doctor's appointment just yet. The researchers behind this study emphasized that AI shouldn't replace doctors entirely, at least not now. Why? Because medicine isn't just about crunching data, it's also about empathy, intuition, and understanding patients as individuals. They predict that in 15 to 20 years, AI could provide instant, personalized diagnostics using your entire medical history, genetic data, and even lifestyle information. Imagine getting a diagnosis as easily as checking your email. What do you think? Would you trust an AI like So-1 Preview with your health? Let me know in the comments. Now, let's address the elephant in the room. Can we trust AI with something as critical as our health? Critics warn against relying too heavily on machines. After all, even the best AI can make errors, or worse, be misused. But the potential benefits are enormous. Catching rare conditions. AI could save lives by spotting illnesses that human doctors might overlook. Reducing medical errors. It's estimated that medical mistakes contribute to over 250,000 deaths annually in the US alone. What if AI could cut that number in half? Accessibility. In rural areas or developing countries where doctors are scarce, AI could bring advanced diagnostics to millions. Of course, all of this depends on how responsibly we use the technology. As the researchers said, AI should enhance healthcare, not replace the human touch. So what's next for AI in medicine? If models like So-1 Preview keep evolving, we could see an entirely new era of healthcare. One where your smartwatch detects early signs of illness and sends data directly to an AI for analysis. AI-powered systems recommend personalized treatment plans tailored to your genetics and lifestyle. And doctors spend less time on diagnostics and more time building relationships with patients. But here's the twist. The role of human doctors will shift. Instead of being the sole authority, they'll work alongside AI as guides, advocates, and interpreters. Think of them as pilots with AI co-pilots. Do you think AI will make healthcare better or worse? Share your thoughts below. OpenAI's 1 preview is proof that AI isn't just the future of medicine, it's the present. From diagnosing rare diseases to crafting detailed medical plans, this technology is a game changer. But as incredible as it is, we can't forget the importance of human expertise, compassion, and intuition. So, will AI replace doctors? Not entirely, but it might just become their most powerful tool yet. If you found this fascinating, make sure to hit that like button and subscribe for more deep dives into AI and the future of tech. And if you're curious about how AI is changing other industries, check out this playlist right here. See you in the next video.